So, if your flat faced dog snores, struggles to breathe, or overheats easily, this surgery can be life changing. And here's exactly how I approach it. When I perform brachycephalic airway surgery, my goal isn't just to make dogs quieter, it's to make breathing easier for the rest of their lives. I don't just remove tissue and hope for the best, and every patient gets a complete airway examination under anesthesia. I'm going to evaluate the nostrils, looking for stenotic nares, the soft palate, the larynx, laryngeal saccules, and any evidence of laryngeal collapse and any additional abnormalities. The opening to the trachea is the shape of a diamond. The soft palate can obstruct the top of the diamond. The everted saccules can obstruct the bottom of the diamond. Add a poor intake system of air through the nostrils and years of negative pressure and vibrating soft tissues that swell in the back of the throat, and we have even more tissues to deal with. The airway is one system. If you only fix one obstruction, you're often leaving one other one behind. So I almost always begin with widening the nostrils. Think of breathing through a tiny straw versus a large pipe. Opening the nostrils dramatically decreases resistance before air even reaches the throat. So the goal isn't to make the soft palate as short as possible. The goal is to restore more normal anatomy. If you remove too little, the obstruction remains. If you remove too much of the soft palate, you increase the risk of aspiration pneumonia and chronic complications. So precision really matters here. So, what are everted laryngeal saccules? Well, they mainly function to lubricate the vocal cords, and they're normally inverted. And those laryngeal saccules have been pulled into the airway from years of excessive negative pressure, and I remove them to improve the airflow, especially at the bottom or the ventral aspect of the larynx. So, imagine your airway is a hallway, and laryngeal saccules are like two small storage closets built into the walls. Normally, they're tucked away and they don't affect anyone walking through. But if those closets collapse into the hallway, they narrow the passage and make it harder for everyone to get through. Before waking the patient, I'm going to reassess the airway. I want to make sure that airflow is significantly improved and that no bleeding or obstruction remains. Now, the recovery part is just as important as the surgery part. Surgery is only half the battle. Recovery is critical. These patients are carefully monitored because airway swelling can occur after surgery. We need pain control and oxygen support when needed, and keeping them calm and close observation are just as important as the operation itself. In fact, a lot of these dogs are so used to breathing through such a small airway that when we intubate them, they actually are one of the groups of patients that don't automatically cough their tube out when they become conscious again. They'll actually get up and walk around the hospital with their endotracheal breathing tube still in their throat. So, one of the biggest mistakes in recovery is waiting until dogs are in crisis. Years of struggling to breathe create chronic inflammation and enormous negative pressure inside the airway. Eventually, it's going to lead to irreversible laryngeal collapse, and earlier intervention often means a better long term outcome. Brachycephalic airway surgery isn't cosmetic, it's reconstructive surgery designed to help these dogs breathe and exercise and stay cooler, sleep better, and enjoy a better quality of life. So, if your dog snores loudly, gags, overheats easily, or struggles after exercise, don't assume it's normal for the breed. Have their airway evaluated. For more interesting facts about airway surgery in dogs, make sure you follow me.